Who, what, where, why, and how? The answers are Inside Health.
In this edition of Inside Health, a new fertility kit for men has been launched to help thousands of couples trying to have a baby. The British scientists who designed the kit hope it will encourage couples to test their fertility earlier rather than discover problems later on. While the US strengthened its zero-tolerance drug regulations earlier in the year, lax new laws in Canada now allow people with chronic conditions to grow and smoke marijuana, or designate someone else to grow it for them. Researchers in the United States are set to start human trials of a new Alzheimer's vaccine, which has been shown to block the development of the disease in genetically engineered mice. And athletes are getting serious about sweat. Using special patches and plastic bags, researchers are analysing results in order to find out what their bodies are losing and how that loss affects their performance. But first, surprising new research reveals that over a quarter of the population has an opening in the wall separating the upper chambers of the heart, albeit just millimeters in diameter in most cases. Less than 5% of the population has a hole that's 1 centimeter in diameter, and these people are the ones who are particularly at risk. According to cardiologist Dr. Peter Wilmhurst, the discovery was made while studying divers who'd suffered decompression illness. It was found that the majority of them had a hole in the heart which was present since birth. This hole is present in all of us in the womb, where it's necessary for survival, but in the majority of cases it seals up entirely within a year after birth. Doctors have since closed the holes in a number of divers' hearts, which has allowed them to return to diving. Patients have reported fewer migraines as a result of their surgery as well. The fight against heart disease has been stepped up with the approval of a new heart imaging agent that should provide earlier diagnosis for millions of patients at risk. The new contrasting dye called Definity is injected into patients undergoing echocardiograms to improve imaging. It enables doctors to distinguish between normal and abnormal heart structure and motion by improving the visualization of the primary pumping chamber of the heart. Definity produced diagnosable images in 91% of the 1,700 patients tested who had difficult to read echocardiograms. It's believed the use of ultrasound contrasting agents will help doctors diagnose patients at a faster rate and therefore avoid other costly tests. Definity is the first and only contrasting agent in the US that's not derived from blood, eliminating the risks and concerns associated with blood-based products. In related news, research in the New England Journal of Medicine has found that patients who have traditional heart bypass surgery are at greater risk of stroke, but a new procedure allows physicians to operate on the heart while it continues to beat, rather than stopping it and using a heart-lung machine. The idea is to allow the heart to continue routing blood and oxygen through the body. In beating heart surgery, physicians can use a new device that works with a vacuum suction. It lifts up the heart so that the surgeon can access the back of the heart and perform a bypass on hard-to-reach vessels. During his beating heart surgery, Charles Abdo also had a less invasive endoscopic procedure performed. Beating heart procedures now make up almost 22% of all coronary bypass surgeries. The best way to avoid needing any coronary surgery at all is to reduce cholesterol. Diet and exercise can help, but prescriptive medications known as statins can dramatically improve the condition. However, Bicol, a statin drug produced by the German pharmaceutical company Bayer, has been pulled from the market because 31 fatalities caused by muscle deterioration were reported in American patients using the drug. Public Citizen, a Washington-based consumer advocacy group, is concerned that these other statins might have side effects equally devastating as Bicol, and have filed a petition requesting an additional warning be included with statin medications. When Kenyan President Daniel Arap Moi announced he would import 300 million condoms to fight AIDS, the streets of Nairobi were silent. But when he pleaded with Kenyans to abstain from sex for 2 years, silence turned into laughter. He went on to say that the best cure would be people's abstinence, which would drastically reduce the pandemic within just 2 years. But fighting AIDS in Kenya is a serious undertaking. It's estimated that 700 of the country's 30 million people die each day from AIDS-related conditions. In 1999, when an estimated 180,000 Kenyans died of AIDS, President Moi declared the epidemic a national disaster and formed a National AIDS Control Council to help battle the spread of HIV. Because of cultural taboos surrounding sex and death, Kenyans have long been reluctant to address AIDS. But they're beginning to now. In recent years, AIDS prevention campaigns have spread throughout the country, using methods such as billboards and classes that teach correct condom usage and disease prevention. Kenyans are divided over the government's recent announcement. However, some may follow President Moi's advice and refrain from sex. But for the majority of Kenyan couples, abstinence seems unrealistic. And as South Africa's president was meeting with President Bush in Washington, a lawsuit against his government was being announced. South African HIV-infected mothers have taken legal action for denying them powerful AIDS drugs which could block mother-to-baby HIV transmission. "70,000 infected children are born each year in South Africa. AIDS activist groups say that numbers could be reduced by 40% if the government approved the use of antiretroviral drugs like AZT. Attending a recent AIDS summit at the UN, South Africa's health minister argued she will not give out AIDS drugs to pregnant women until health and safety issues are resolved. That despite the fact that AZT has been proven 90% effective in saving babies from HIV. While groups like Love Life campaigned in support of the court action, the UN summit convened to try and tackle the global health crisis. But after 3 days of talking and arguing, activists concluded that nothing concrete had been achieved. And still on the AIDS front, US health officials are worried, despite the fact that the number of Americans contracting HIV and developing AIDS has dropped significantly since the mid-1990s. Risky behaviour is on the rise, especially among gay men and low-income African-American women, according to reports presented at the National HIV Prevention Conference in Atlanta. Researchers found that women are increasing their HIV risk by having sex with bisexual men and failing to use condoms during all sexual encounters. Many young people also have the misconception that the antiretroviral drug therapies that have proven effective at keeping the AIDS virus in check are an option to practicing safe sex. The medication may keep you alive, but at a great physical and emotional cost. The side effects from the medication are almost as difficult as having chemotherapy. Despite the slowdown, 40,000 new cases of AIDS were reported in the US last year, while 12,000 people died of the disease.
Oh my goodness, did you see that?
Most pregnant mothers experience their first ultrasound alone, but entire families are encouraged to visit this unique office. Obstetrician Steve Gagliardi says he wanted to offer his patients something more than a clinical ultrasound. Gagliardi, like several others across the US, is offering videos and CDs, but a few are also giving parents the opportunity to see their baby in 3 dimensions. The baby, however, must cooperate, that is, remain in a good position to capture all of the contours of the face. For Sue and David Steinhoff, even a side view of their unborn infant is a thrill. Christine Morrill opened her service in Providence, Rhode Island. She says parents are ecstatic with the 3D results. Likewise, technician Debbie Torres enjoys giving families undivided attention.
Sure.
But some physician groups say these entertaining ultrasounds are a misuse of technology, claiming 3D ultrasound should be used for diagnostic purposes only. But before the magic moment arrives, women worried about the ticking of their biological clock, or men concerned about the health of their sperm, will soon be able to test their fertility without leaving home. Instead of enduring awkward questions in doctors' surgeries, blood tests or producing sperm samples on request, couples thinking about having children could check their hormone levels and sperm quality themselves. Fertel, the world's first his and her home fertility kit, should be available very soon. Studies on both men and women have shown it to be about 95% accurate. At present, only a third of all men who are supposed to turn up to a clinic to give a semen sample actually do, primarily because of embarrassment and stress, problems which the new test kit should completely eliminate. And while it won't detect all causes of male infertility, it will identify the majority of conditions. The test detects only the fittest or motile sperm, in other words, the fastest swimmers. In the race for life, it's all about the survival of the quickest. Fertile men produce at least 10 million motile cells. That's about 40% of an average sample. Anything less, the chances of conception diminish rapidly. Semen is placed into a container. Artificial cervical mucus is released and heated to 37 degrees Celsius. Only motile sperm are capable of swimming through the mucus, where they are counted and tagged with gold label antibodies. Once the magic figure of 10 million is reached, a red line appears indicating fertility. The whole exercise takes about 30 minutes. Professor Chris Barrett, who led the research, hopes the test will help men to overcome their reluctance to seek help. As more couples leave it later to start a family, detecting fertility problems early is vital. About 1 in 6 couples have difficulties conceiving naturally. Of those, about 40% are attributed to male infertility. In startling contrast, Sikh priests have launched a campaign against the growing practice in India of aborting girl babies in the womb. For every 1,000 boys up to the age of 6, the census showed only 927 girls, down from 945 10 years ago. Here, in the Sikh heartland of northern India, the figures are even more alarming. In some areas, there were 750 girls per 1,000 boys. The Sikh clergy are so alarmed at the declining sex ratio, they're attempting to change the traditional culture that values boys above girls. A 1994 ban on using medical tests to determine the sex of fetuses is rarely enforced, and up to 5 million babies are aborted each year, the majority on the grounds of gender. But Indian social and cultural structures mean that poor Indian women are an economic burden on their families and communities. India's census shows that authorities can't afford to ignore the issue of female infanticide any longer. Petting your pooch is of course pleasurable, and it can actually prolong your life. Elderly people in particular benefit from having a dog or cat to pet. Research shows that pet ownership has a positive effect on mental well-being and also on seniors' physical health. Not only does caring for an animal ease the loneliness of the elderly, it also provides a focus which can improve cognitive abilities. Simple stroking of a cat has been proven to relieve stress and can also help to reduce blood pressure. While dogs have been shown to encourage people to exercise, get outdoors, and even be a source of meeting new friends. Dogs have always been man's best friend, but for some elderly, they can be lifesavers as well, giving a reason to live. And while we're on the natural medicine front, researchers are urging people with upcoming surgeries to tell their physicians what herbal products they're taking to avoid serious post-operative problems. The risk of bleeding or heart and blood vessel problems increases, while some herbs can even interfere with medications used in conjunction with anesthetics. According to anesthesiologist Dr. Jonathan Moss, patients using herbal products containing ephedra, ginkgo or kava should stop using them 24 hours before surgery. Patients using garlic, ginseng or St. John's wort are advised to stop up to 1 week before surgery. And speaking of natural drugs, under new regulations, Canadians suffering from terminal illnesses and chronic conditions can legally grow and smoke marijuana or designate someone else to grow it for them. Canada's new rules constitute the first system in the world to include a government-approved and paid-for supply of marijuana used to treat the sick. The new regulations, which went into effect recently, have already prompted hundreds of people to apply for exemptions from the federal drug laws. Meanwhile, US supporters of medicinal drug use applaud the Canadian government and hope that the United States will follow in its neighbours' footsteps. But that doesn't seem likely in the near future. Only 8 states have passed laws permitting the use of medicinal marijuana. Coffee shops designated for pot smoking sprang up in cities like San Francisco, only to be shut down shortly thereafter. The US strengthened its zero-tolerance policy earlier this year when the Supreme Court ruled that there is no exception in federal law for people to use cannabis, so even people with state medical exemptions could face arrest. The Canadian government will grow marijuana crops in a former copper mine in Manitoba. When it comes to Alzheimer's, there's a huge gender difference. Women in their 60s and 70s are 3 times more likely to develop the brain-wasting disease than men, and it's only when men hit their mid-80s that the ratio evens out. A new study has found that the male hormone testosterone has the potential to protect against Alzheimer's disease. Human brain cells are being examined to see which hormones protect them under laboratory conditions. It's long been known that estrogen helps preserve cells, but scientists now hold out hope that testosterone may delay the onset of the disease by as much as 20 years. In Britain, investigators say they're now able to detect Alzheimer's disease in its earliest stages by using an MRI scanning technique. The voxel compression mapping system identified early changes in the brains of people from families with Alzheimer's disease, even though the patients were still symptom-free. The study, reported in The Lancet, says the technique also confirmed that the medial temporal lobe is the area of the brain where Alzheimer's disease begins. These findings will help physicians diagnose and treat the disorder at an earlier stage, before the devastating cognitive decline has been established. And a new vaccine developed by researchers at New York University Medical School has been successful in blocking the progress of Alzheimer's in genetically engineered mice. Alzheimer's disease is characterized by the destruction of nerve cells, especially in the areas of the brain responsible for memory and learning. Abnormal structures in the brain, called plaques, are one of the hallmarks of the disease. The researchers injected the new vaccine into 11-month-old mice that had formed plaques in the brain. Several months later, the researchers examined the brains of the mice and found that the amount of plaque was reduced by 89%. 4 million Americans have Alzheimer's disease, including 1 person in 10 over the age of 65, and nearly half of those are over 85, according to the Alzheimer's Association. The group believes that without a cure or prevention, the number will jump to 14 million by 2050. Fortunately, doctors are optimistic that the initial success found in the trials on mice could work on humans as well. And even if the translation to humans means that the response is not quite as dramatic, it should still offer a significant effect. Leading researcher Dr. Blas Fangioni hopes that the vaccine can eventually be used on humans, well before Alzheimer's sets in. The goal will be to prevent the disease from taking hold rather than trying to treat it once it appears. Alzheimer's is a progressive, degenerative brain disease which causes confusion, personality and behavioral changes and impaired judgment. It not only affects the lives of millions of sufferers around the world, but often devastates the lives of their families, friends and caregivers as well, which is why such a concerted international effort is underway to wipe it out completely. This study has since been published in the prestigious American Journal of Pathology, and researchers are expected to test the vaccine in initial human clinical trials within a year. While most of us know that cycling in a gym is a good way to stay fit, we also know how tedious it can be. That's why one New York gym has decided to mix a little song and sweat in a novel new class called Karaoke Cycle. For a full hour, class participants ride their stationary bikes at full speed while singing or attempting to sing their favourite and not so favourite tunes. Cycling is an exercise that's good for the lower body as well as the cardiovascular system. It builds up the heart and puts leg muscles through their paces. The karaoke element is good for the vocal cords and adds a little extra fun and motivation. No one is forced to take the mic, but most spinners seem to enjoy the extra spice that singing adds to their fitness classes, which aren't so tedious anymore. And when you exercise, you sweat, which is really just the body's way of cooling itself on the outside and cleansing itself on the inside. Researchers are collecting sweat using special patches and plastic bags to find out what the body is losing. For the American athletes taking part in the study, this is serious business, as the results may affect their ultimate performance. When the body sweats, it's not just fluid which is lost. Electrolytes like potassium, sodium and carbohydrates are lost as well. If these aren't replaced, the body simply can't work as well. Both muscle and mental function is impaired, and that applies to everyone, not only top athletes. Fitness trainers advise their clients to replace lost fluid during intense physical activity every 15 minutes. Sweating not only cools, but cleanses the body, so it's important to give it the tools needed to sweat freely, and that means drinking water throughout the day and not just to quench thirst after exercise. An estimated 80 million people in the United States started fitness programs last year, but 95% of them failed because they lacked clear goals and a way to track their progress. But now fitness management technology can fit in the palm of your hand. To start off, a user sets up PC software to track his or her goals, whether it's weight loss, improved athletic performance, or overall health. The software asks about daily schedules, medical health, exercise history, and current activities to create an individualized plan to meet those goals. With a click of the mouse, the entire plan is downloaded into the handheld fitness planner. The database itemizes more than 4,000 food items to help the user track their daily intake of calories, grams of fat, protein, carbohydrates, and sodium. The bottom line is that the Palm Fitness Planner can make it easier to incorporate a well-rounded fitness routine into an already busy day.